Are you suffering from lower back pain? First thing in the morning, you feel stiff in the morning, it is hard to lift something, or it is really painful throughout the day in your lower back, then this 7 exercise routine is for you. This exercise is combination of hip muscle stretches, lower back stretches, and also important stretches in the leg as well that can contribute to your lower back pain. So let's check it out. Hi, my name is Rakesh and I'm a physiotherapist in Alberta, Edmonton. As I treat these lower back pain patients, one thing that responds well is the combination of the mobility. So movement is very important, and that is what we are going to do today. Stretch number 1 is knee to opposite chest. Now this stretch is important because this is not regular gluteal stretch, hip stretch. This is knee to opposite chest, meaning you are stretching the gluteus muscle here that is responsible for the back pain as well. So what we are going to do is you lay on your back, and then we keep one leg straight, and then use your both hands to grab your knee towards your chest. This is a regular stretch. So what we are going to do is when you bring your knee towards your chest, you're going to pull that knee towards the opposite shoulder, and you're going to get an intense stretch in the left hip if you're doing the left side. Now if you feel like you can't bend your hip as much, or you can't bring the leg as much in, you can just keep it there if you're feeling it. As long as you feel a stretch, that is the goal. Goal of this whole exercise is to feel the stretch, is not to how far you go. Then you change the side, and then we are going to do the other side. Here I recommend that we do this for at least 30 seconds. So it's a big muscle, it needs longer stretch, and we can do 3 reps on each side. All of this exercise we can repeat like this, and then increase the numbers. Stretch number 2 is called prone passive lumbar extension. Here we are going to move the lower back in extension, which is one of the most movement we avoid. So we do bending lot, we do lifting lot, we slouch sitting, so it puts a lot of flexion load on the lower back, and this is the movement that we can do to avoid the flexion load. And this is also well researched by McKenzie, and it shows a good amount of result with lower back pain. How you do it is you go on your tummy, and then you bring your both hands away from you, and then you're going to lift yourself up. It is called passive because you're not using your hand as a push-up, or you're not using your back muscle to be activated. Here we can do this again, 10-second hold, few reps, and you do it based on your comfort. If it is painful, you take it easy for sure. As you can progress, you want to lift yourself a little bit up, go on the elbow, go on the wrist, and you're completely arching your back. This is one of the stretch very important for regular routine. If you are having a morning stiffness, if you are having pain while you're sitting, and then you get up and your body is stiff, this is the motion we want to. Third exercise is cat and cow. Now cat and cow is a coordination of the lumbar and the core muscle exercise. Also it mobilizes your lower back, T-spine, as well as a little bit upper back. How you do it is you go on your hands and knees, so you go on your all four. If you have pain in the knees, you can use some pillows here. Now what you do is we are going to create lumbar arch and lumbar flexion. So here you drop down your belly button towards the floor, lift your head up, and then you're going to hold this for a few seconds, and then try opposite side. And then here you lift your lower back towards the ceiling, and you're trying this as much as you can, and then bending your head, and you're sinking in like a cat. This is called cat and cow or cat and camel. Exercise number 4 is sideline trunk rotation. This is very important stretch if you are having issues in your lower back on the side or SI joint. Because SI joint is responsible for rotations, this exercise becomes very important. Now what we do is you go on your sideline and then bring the top leg forward and bend it, straighten up the bottom leg. Technique is very important here, so just watch here. So straighten up the bottom leg and then bring the top leg and bend it, and then you're going to start with clapping the both hand on the side, and then you're going to move one hand away from it with rotating the upper body. Here the arm that's moving, you're not stretching it, you're just guiding it. So this is a guiding arm, and you're going to rotate with it, and then you're going to hold for a few seconds when you feel it's not moving anywhere. Here you want to use gravity. The most important part about this stretch is let the gravity do the work, let the weight of the arm do the stretch rather than forcing it. We're not trying to crack it. This is the chiropractic manipulative position though, but we're not trying to crack it. You're just mobilizing the SI joint here. Hold for 10 seconds maybe and do 10 repetitions if you can. If you can't, at least 3 reps is good idea, and you can repeat same on the other side. So again, when you do this, technique is important that you want to bring the top leg on top of it and then bottom leg straight. Top leg rotates forward, and you can do this easily by yourself anywhere. You need a solid surface though, but you can do it on the bed as well if you are not mobile. Stretch number 5 is the hamstring stretch, which is supine hamstring stretch. Here we don't want to bend the back as much, so we're going to do this on the back. You lay down on your back, use your both hands, you grab your thigh from behind, and then one leg goes straight, and then you pull the thigh towards you. That's step 1. Step 2 is where you straighten up your knee. If you start feeling a stretch, we just stop and enjoy that stretch, hold it for a few seconds, and then step 3 is you pull the foot towards you. That's it. This is the stretch you can do for a few seconds, hold again, 3 reps at least, and you can do the other side. Same thing, use your both hands, pull towards your thigh and straighten up the knee and pull foot inwards. 6th stretch is the gluteal stretch. It is important to stretch the gluteus and hamstring if you have a back pain, because these are the big muscle group, plays important role in the back movement. Now how do we do this is you're going to go on the 90 degree with your front leg, and you twist the back leg and you go 90 degree. Now once you are in this position, you are only leveraging your weight to go forward. So when you are there, you're just bending your hips, you're trying to just bend forward, not from your lower back, just the hip, and you're getting a gluteus stretch on the front leg. This is very intense stretch. If you have knee issues, if you have surgeries in the hip, you want to avoid it, you talk to your professional about it. Otherwise this is doable. Same thing, we're going to hold for 30 seconds if it's possible. Otherwise you can do 10 seconds and few reps with it. Now switch the sides, and then we do the other side. Same thing, you try start with 90 degree movement of the knee and hip on the right side, and then same thing with the left side on the back leg. You can repeat this as much as you can every day, at least few times a day. Now 7th stretch is the child pose. We talk about the flexion and extension motion, but this is not extension, this is flexion. We do need flexion when we have issues in the back, so we're not avoiding, but we don't need a loading flexion. We don't need to load the disc or the joint, so this is where we can use child pose. So your weight is a little bit on the hand and you can easily do this. So you go on your knees and you're sitting backward, you're resting and starting, so you outstretch your arm and you pull forward, and then you're going to go sit backward. Again, if you have upper back pain, this is also a good stretch. You can hold this for a few seconds, get the stretch going, let your knee sit down and let your ankle rest as well. This is very important stretch for anybody with the lower back, hip or upper back issues as well. So this is it. These are the stretches you can do. Now if you have any other issues like headaches or upper back pain, neck pain, I have other videos as well, so check this out, and also share this if you like this content, and please subscribe if you're new to the channel, because I'm going to have videos very frequently and these are going to be very educational. Thank you.